All right, the government certainly seems to like Medicare Advantage plans. So we're going to talk about that today. And then there's also, if you're watching this live, we've got a Q&A that's coming up right after I talk about Medicare Advantage, Dr. Oz, and all of the ways they're kind of leaning towards Medicare Advantage. When you sign up for original Medicare at 65, or after you stop receiving health insurance from work, or you receive disability after 24 months, you sign up for original Medicare Part A, Part B. There's a lot of gaps there. If you got a whole bunch of money, then you're good. But if not, a lot of people get either a Medicare supplement plan, those are the plan N, G, F, or you get a Medicare Advantage plan. If you're a regular viewer to my channel, you know that I always recommend checking out Medicare supplement plans first, but it really depends on your particular situation. They're good for some people and maybe not so good for other people. It really depends on your budget and all the rest of it. So let's talk about that today. And then all looks like I already got a bunch of questions there. Then we'll get into all your questions about all things retirement, survivor benefits, Medicare, Medicaid, all the rest of it. Okay, so what are we looking at here? How are they pushing people leaning towards Medicare Advantage? If you've ever watched Dr. Oz, his TV show, you know that he used to have Medicare Advantage companies come into his TV show and talk about Medicare Advantage. So he's been a big fan of Medicare Advantage since day one, I guess. And he has also floated the idea of Medicare for all. So having a single payer universal system, and his would be kind of a Medicare Advantage for all type of situation. That's one of his proposals. Okay. There's also a bill in Congress that is talking about making Medicare Advantage the default. So when you sign up for original Medicare Part A and Part B, you don't get that. You sign up for actually Medicare Advantage. And that is a bill, but we all know what a bill is, right? Us from the 70s know what a bill is. A bill is just a bill. It's not a law yet. So if you think everybody should automatically be signed up for a Medicare Advantage plan, then go ahead and support the bill. If you don't, then maybe you should contact your congresspeople and say, hey, not so fast. We'd like to have the options. And Medicare Advantage plans, I've got a lot of regular viewers here that love their Medicare Advantage plans. I've already got some questions and some comments here about people, they love it. Some people hate it. So, but at least with other options, you have other options. You have a Medicare supplement plan and stay with original Medicare or Medicare Advantage. But it seems like the government is kind of pushing people to that other side. So there's the default, Dr. Oz. I just did a video a couple of 3 days ago that they're starting prior authorizations in test states. There's 6 states that they're attempting to start prior authorizations with original Medicare. That's one of the reasons people stay with original Medicare, is because they didn't have prior authorizations. That means if the doctor says you need whatever procedure, then some insurance company bean counter doesn't get involved in there. It's between you and your doctor. That's why people like the original Medicare and then getting a Medicare supplement plan. But now they're introducing prior authorizations to original Medicare, which is pretty much the first time they've ever done that. But again, this is a test case. It's going to start, I think, January of next year, if everything goes as planned. And 6 states, and there's about 17 different types of programs, and they're doing it based on, again, that cover all. Anytime they say fraud, waste, and abuse, it seems like we, as the American people, allow the politicians to do whatever they want, as long as they say fraud, waste, and abuse. So that's what they're using to bring in these prior authorizations. Okay, so in terms of Medicare Advantage plans, why is there such a push to get you on a Medicare Advantage plan and not stay on original Medicare? Even though people say, well, it's cheaper. Well, it's cheaper for you. If you get a Medicare supplement plan, you still have to pay your Part B premium, the $185. And then for a Medicare supplement, there's a premium for that. So you have to pay your Medicare supplement premium. And then Part D, the prescription drug plan, doesn't come automatically. So you have to pay for that as well. So you've got 3 different costs there, okay? If you get a Medicare Advantage plan, then you still have to pay the $185, but a lot of those plans are 0 premium per month. A lot of Medicare Advantage plans, zero premium, not free because you're paying for them, but it's zero premium per month. And the Part D plan, it's wrapped in there. So you don't have to pay for the Part D plan separately as well. So you figure, okay, that's cheaper for you, but it's not cheaper for us, for the government, for we, because Medicare Advantage plans cost us about 4 to 8% more per person in healthcare costs. And because if you've got original Medicare, the government pays, let's say, 80% of your Part B, surgeries and stuff like that. They pay 80%. So they still have to pay 80%. But if you have a Medicare Advantage plan, they pay more. Basically, what happens is the government pays Medicare Advantage plans. When you sign up for a Medicare Advantage plan, then that company goes to Washington and says, hey, we just signed up Nancy or Dory or Barbara, and give us that person's money. And that's what they do. They give that company, I think it was last year, is about $15,000 on average. So if you go to the doctor once a year and that you get charged $100, $200, the insurance company just made a $14,000 plus profit off of you. So it costs a lot more money to put people in Medicare Advantage plans. But the government, even though it costs more money, the government, our politicians like it because one of the reasons is it outsources problems. You are no longer part of a government Medicare Part A, Part B program. You're in a private insurance company with whatever insurance company you choose. So they kind of, the government's problems are outsourced to these private companies. And people like them. There's a lot of people that love. I've got a lot of regular viewers here love their Medicare Advantage plans, and more power to them. If you like it, if it's good for you, then it's good for you. Just have to check it, quite every year because they change every year. But people like them, and politicians don't want to mess with things that people like because politicians are all about getting reelected, right? So, and it's always about follow the money. Massive profits in these Medicare Advantage plans. And because there's massive profits, there's obviously massive lobbying. So these health insurance companies send their lobbyists to Washington to make sure they continue to get these massive profits. Politicians, another reason politicians like them is because they're easy to budget. When you're looking at original Medicare, the prices go up and go down depending on how many people use the hospital or doctors or getting old or whatever the case may be. So the costs fluctuate. With Medicare Advantage plans, you always know, okay, you've got X amount of people signed up. Here's how much we pay every year to these Medicare Advantage plans. It's easy to budget. So just laziness, I guess. And as anything else with the government, there's a revolving door. Once a politician or some, politician's assistant leaves the government, they often go work for that Medicare Advantage company, and we see a revolving door. So they continue to support Medicare Advantage plans. And again, that's what you like. That's what you like. More power to you. But it's nice to have options, and it's also nice to know why a lot of people are being pushed into Medicare Advantage plans by the government. Okay, I went through that relatively quickly, so we can get into as many questions as possible. All right, so we got Barbara, who is a member. Will we be required to fill up our Medicare Advantage plans, give up our Medicare Advantage plans? These Advantage programs don't accept my doctors, etc. We're going to be in trouble. These programs try to get out of everything. Yeah, that's one of the reasons, people that sign up for a Medicare Advantage plan and at zero premium, they love it until they don't, until they actually have to see something and their network starts to diminish. And I'm going to be doing a video probably tomorrow on that fact. A major U.S. health insurance company just said they're going to be canceling about 600,000 people from Medicare Advantage. So I'm going to talk about that tomorrow, that breaking news. So with any of these, on any type of government type thing, let me go ahead and pull up my website here, and I'm going to give you the trick on doing this. If you have whatever with Social Security or Medicaid or whatever, there's always appeal rights. So go onto my website, mygovexpert.com, and then click on, there's all kinds of different sections, retirement, disability, and everything, but click on the appeals section. And on the appeals section, it tells you, you have Medicare appeals process, you have the Medicare Advantage appeals process. So basically, if they deny you or whatever the case may be, they deny you to, whatever procedure, or, they charge you more, whatever the case may be, you can always fight it. So always fight it. So Medicare Advantage plan, there's different levels of appeals, and it gives you each company is a little bit different in their process, but this gives you kind of a general idea of how to fight it. And remember, you can change your plan starting October 15th. So from October 15th to December 7th, if you don't like the plan you're in, then you can change it. Or some people can change it early. If you're like in a dual eligible plan, you can change it pretty much more often, quite more often. If you move, you can change your plan. There's other kind of extenuating circumstances where you might be able to get out of that plan and get into a plan that covers your doctors or costs you less money or whatever the case may be for, whatever procedure. So you can reach out to Chapter. They sponsor this live Q&A, and they can help you, and they're 100% free. So Nancy, I feel I was not pushed into my Medicare Advantage plan. In my county, the plan I have was considered the best one out of our choices. Perfect. Awesome. But yeah, that's the key thing. You don't push. I always say I prefer Medicare supplement plans because I don't like the prior authorizations. I don't like the limited networks. So I recommend a Medicare supplement plan. But there is a monthly cost to that. And some people it's not in their budget. So as long as you know that, that's the key, Nancy. When you're 65 or when you're new to Medicare and you want to go ahead and sign up, you're given all your options. But if your option is, this or the highway, then that's not much of an option. So Nancy, hopefully they gave you your option and you say, oh yeah, now Medicare supplement is just not for me. I'll do a Medicare Advantage. Then beautiful. Awesome. I mean, our standard Medicare, will this be absolute advantage from? Okay, yeah. If to mandatorily give up your original Medicare and push you to Medicare Advantage, hopefully that doesn't happen. Hopefully it doesn't happen. So that's why we need to reach out to our politicians and make sure it doesn't happen. I absolutely hate the Advantage plan I'm in. No one explained to me that I could possibly not qualify for supplemental plan later if I went to an Advantage plan. Yes. And that's the thing is people sign up for a Medicare Advantage plan when they're young, 65 years old, because when you're young, 65 years old, you're still relatively healthy. And you're like, why should I spend, $80, $100, $120 for a Medicare supplement plan when I've got a Medicare Advantage plan that's zero and I really don't need it? So why waste that money? So I'll just go ahead and get the zero option because I'm young and healthy, but we're not young and healthy forever. And then a year, 2 years, 3 years, 5 years, 10 years later, then you can't switch to a Medicare supplement plan. But there are times you can, and I'm going to be talking about that tomorrow. So about 1 million people are going to be very, very happy of what just happened. So people always say sometimes I focus on the negative because Social Security is, kind of we're in dire straits, and we've got 90 more checks at 100%. And then we're going to see cuts of 23%. So I'm not negative. I'm just realistic. This is a fact. But tomorrow I'm going to talk, I'm going to do a little twist on it, and we'll talk about the good thing that people are getting canceled. So Dr. Oz is not good for people in America. Love to throw him out of office. Dr. Oz is owner of a large Medicare Advantage company. Let's see. Someone just got off the phone with James at Chapter and treated them awesome. Perfect. I didn't catch the end of your message there, so apologize for that. Check your zip code. My zip code only allows one, and I wouldn't use that supplemental insurance ever besides. A lot of doctors won't take Medicare Advantage only or primary care. Yeah, the Medicare supplement plans, there's state type plans, Medicare Advantage plans. They have, there's several dozens, maybe hundreds in your particular state. So Medicare Advantage plans go by your zip code, exactly what area you're in. Medicare supplements go by the state. And there's some states like New York and other places where you can sign up for a Medicare supplement at any time. So, true justice. I want nothing. I wish to be in charge, much cheaper, and I am much healthier. All right. It's a beautiful thing. Leave original Medicare alone. It's not broken and it doesn't need fixing. Um, yeah, well, I don't know about not being, it definitely the budget is running out on it. But I see what you're talking about. There's 6 major gaps to original Medicare, and I think those need to kind of be fixed. Like the 80% co-insurance and stuff like that. I think original Medicare should have, vision, dental, and hearing should be included in there. Yeah, as compared to other options, I agree with you. How do you put Social Security on pause if you took early retirement before your full retirement age? Okay, so there's 3 ways you can do it. One is just completely withdraw your application, and you can do that within 12 months of starting your benefits. And then you have to pay back all your money because you basically withdraw your application. At the other end, once you hit your full retirement age, just before you hit your full retirement age, you can suspend your benefits. It's called voluntary delayed retirement credits. To get those delayed retirement credits. So it's a voluntary delay. In between those 2 times, basically the only time you can do it, the only way you can do it is if you're working and you're making over the annual earnings limit. So this year it's $23,400. And so for whatever reason, you're making $80,000. And so, you thought you were going to retire, but then you went back to work. Then you just call up Social Security and say, hey, I'm going to be over the $23,400. I'm going to be, $60,000 over. So they will hold back $1 for every $2 of benefits over that. And therefore, that's essentially a suspension. So, and they'll add that time back to you later. So if you don't get X amount of checks, they will add that time, those reduction back to you once you hit your full retirement age. So. Changes. Dr. Weir, thanks for helping me at a critical time. Oh, awesome. You are a champion for Social Security. Thanks for your service to our country in both civilian and military roles. Please run for Congress. Yeah, I don't think they want me in Congress. And remember, Changes, I'm just some idiot here, spouting for an hour pretty much every single day. The reason you were able to hear the information is because Tweety Bird and Inlays and Jody and Rudy and Angel and Connie and Nelson and everybody subscribed and liked and shared the video. That's how we're getting out there to the community, is by y'all doing your part. So I got no problem sitting here talking to one person, but it's nice to talk to even more. So, a follow-up. Some things I read said I can't work more than 45 hours of self-employment or I lose all benefits for that month. Is that correct? Or does the 1950 rule apply? When you're self-employed, it's kind of strange, yeah, because it's net income. So your net income for 1950, the 1950 is your first year. If you started your benefits last year, then 1950, yeah, that doesn't apply this year. You have to stay under $23,400 in gross wages or net income from self-employment. But Social Security also recognizes that when you're self-employed, a lot of times people work for a year or 2 years and don't make any money. So they have kind of a limit, an hourly limit, or a total hours worked per month, and they consider you kind of, working full time. But between you and me and nobody else, how do they know how many hours you're working? The only way Social Security knows is that when you file your taxes and next year your net income is under $23,400, that's, you don't report your hours to the IRS, and the IRS, doesn't report it to Social Security because they don't get it. So that's between you and me. But if for some reason someone drops a dime on you and, says, oh yeah, this person was, then they'll investigate and stuff. So, but yeah, I've never, ever heard that happen. So there's that. I don't want to, tell you to do things incorrectly. I'm just telling you how the system works. So I don't drive, and most of the doctors in my town will not accept Medicare Advantage. We can't keep doctors in my town anyway. They move where the money is. Yeah, and that's going to be so much worse going forward because the trillion dollars, essentially 900 and billion dollars of cuts to Medicaid is going to make all of this worse because it's really going to hurt small hospitals and clinics throughout the United States because they're going to be losing that Medicaid money. Tens of millions of people are going to be cut off, and so this, yeah, it's going to get, unfortunately, a lot worse. So. Donald, I am the representative payee for my 24-year-old daughter who has been receiving disability benefits on my deceased wife's work record since she turned 16. Okay, is there a follow-up there? Let me see if I can find a follow-up. Okay, there we go. I received a letter from Social Security that they want to talk to me about last year's reporting of her benefits. She lives in Texas. I live in California. What can this inquiry be all about? Yeah, they just want to make sure you use the benefits for her benefits. Yeah, so that's pretty much every year you do that representative payee that hey, last year, Donald, we gave you $15,000 for your child's welfare. How did you spend that money? What did you spend it on? You're like, oh, I spent it on her, rent and food and healthcare and yada yada yada. And then you sent that in, and for some reason there was a flag, probably because you're in one state and she's in the other. But that happens all the time. Kids take care of their parents' benefits, and they live in other states. So as long as you've got receipts that you gave, you use that money for her welfare, then you're good. Don't even worry about it. So don't worry, everyone. I'll fix all of this because I am the Senate. Emperor Palpatine. Yes, the last bastion. I have to appeal now with no Medicare. I can't afford to go to the cardiologist, pulmonologist, etc., without the Medicare to prove I'm still disabled. I don't know what to do. Okay, so you have to prove that you're still disabled. So if you're looking to prove your disability, and this is a good segue. People that are filing for disability or receive disability and have a continuing disability review that they need to do, a lot of those people are kind of freaked out because, well, I don't have health insurance, so I don't go to the doctor, and therefore I don't have any medical records. How am I going to prove I'm still disabled, yada, 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 when I, don't have medical records? Don't worry about it. It happens all the time. Don't worry about it. You really need to get health insurance, Medicare, Medicaid, something, Affordable Care Act, something. But in terms of proving your disability, don't worry about it. If you don't have medical records because you just don't have health care, health insurance, then that's fine. File for the disability benefits, put that in the CDR if you're receiving disability benefits, and say, hey, I can't afford a doctor. That's why I don't have medical records. And they will Social Security will set up a CE, a consultative exam, that they'll have you go see one of the Social Security contracted doctors. So don't even worry about it. So, Deb, husband has me on full coverage from his workplace. Contacted Social Security. They told me that I need to fill out 1763. Is it to my best interest not to take the Medicare Part A and Part B and D? It really depends on your particular situation. If you're currently receiving Social Security benefits, you're going to get, in year 65, you'll get Part A. That's zero premium. So that's a done deal. If you're 65 and receiving benefits, monthly Social Security check, then you're already signed up for Part A. If you have full coverage from work or from your husband's work, and your husband is currently working, this is not a retirement plan or anything, but currently working, and that employer has 20 or more employees, then no, you're good. Yep. Then you can refuse Part B and D and N and E or F or all the rest of it. The only thing you can't refuse is Part A. But everything else you don't need. That is, you're not obligated to sign up for any of the rest of it because you have creditable coverage. But I always say, check. Sure, you don't have to because you have health insurance from current work, but just make sure that health insurance from current work, your husband's, health insurance is good. You're not paying an arm and a leg, and it does cover things. And, just compare apples with apples and say, okay, here's what I've got with my husband's work, and here's what I could get with Medicare, Part A and Part B and a Medicare supplement and all the rest of it. So just check out those options. But no, you don't have to do it at all. So you don't need it at all. Jim, I have been receiving SSDI for about 8 years now. How do I know the amount is correct? Yeah, it's based on your how much you paid into Social Security. So go into Social Security, and everybody do this. Everybody should do this. Doesn't matter how old you are. If you're working and paying taxes, FICA taxes, then you should set up a My Social Security account. Go in there on a regular basis, once a year after you do your taxes and everything, and just check to make sure Social Security records are correct, because that's how they determine how much you're going to make for the rest of your life, is based on how much you actually paid into Social Security. So if those records are incorrect, then your check is incorrect. So yeah, so just go in there, and if everything looks good, then you are good. Richard, I'm on a G now. Is there another supplement plan that might be less expensive? Yeah, the N's are less expensive than a G. The G is like the new F. It covers everything except for the the Part B annual deductible, the $257. But yeah, N's plan N is about 20% cheaper premium per month. So with a Medicare supplement plan, you don't have to wait till October 15th through December 7th. You can change your Medicare supplement plan any time of the year. You might have to go through health underwriting, depending on what state you are and everything. But yeah, you can reach out to Chapter, and they can look for any other plans in your particular area and see if there's something better that you like. And then they'll see whether you can actually switch, whether you have to go through any health underwriting. And health underwriting, it sounds, oh, health underwriting, what's that? There's no physical or anything like that. They just ask you about 30 different questions. Have you had a heart attack recently? Or, you're currently under chemotherapy, just stuff like that. And some companies a little bit more easier than others. And Chapter knows all of those. So yeah, check it out. Excuses, Don, but there is a battle to fight. And fighting is not for someone who really needs the help. It's very hard to believe these people don't care about anyone, only their bank accounts. Yes, and we are about to do that soon. Our community is working on that. Should be done here in about a month, hopefully sooner rather than later. And yes, we are going to be activated. Agreed. Fix the gaps and add dental and vision. I absolutely agree with you, Doctor. Oh, okay. So you're the ones that said, yeah, don't, yeah, but yeah, I knew that's what you meant. I knew that's what you said. We're on that same page. I got hurt at work and never give me SSI. Okay, so SSI is the welfare-based program, supplemental security income. Are you talking about SSDI? That's Social Security Disability Insurance. Everybody confuses that, so no problem. So if you got hurt at work, maybe you got workers' comp or something. But yeah, you can also, if you are disabled, Social Security defines disability as the inability to work substantially. You can still work a little bit and collect Social Security benefits. This year, if you make over $1,620, then Social Security considers you not to be disabled. But if you're under that, because of a disability, and that disability is going to last 12 months or longer or end in death, then could be eligible for Social Security disability. So if you're unable to work, I would definitely file. And on my website, it gives you all of the tips, tricks, and secrets on how to get set up. Not going the Advantage route, heard way too many horror stories. Perfect. Yep. If your budget allows to get a Medicare supplement, that's always the ones I recommend. So, but 51% of people get a Medicare Advantage plan because it's a budget issue, or the people that, help sign them up. Everybody makes more money when you sign up for a Medicare Advantage plan. It's completely counterintuitive. Wait a second. A Medicare supplement plan costs, let's say, $100 a month. A Medicare Advantage plan costs me $0, but the company makes more money by $0? Yeah, because again, that company gets an average of about $15,000 from the government. Well, from you, because that's your tax money, right? Let's see. Dee Dee. Early Social Security 62, working a job that I have health insurance. if still working next year when 65, how far in advance do I let Medicare to not take out the $185 Part B? Okay, good. So you are approaching your 65th birthday and you're currently receiving Social Security benefits. What will happen is they will sign you up automatically for Part A and Part B because you're going to get Part A. You can't refuse Part A. A very, very small percentage of people can refuse Part A, and those are people that have to pay for Part A, but you don't. So once about 100 days before you reach your 65th birthday, they will send you your package with your card in there, your Part A and Part B card. And then it'll give you instructions of how to return it and refuse Part B. So super, super easy. You just wait for your package. So make sure your address is correct with Social Security because Medicare gets the address from your Social Security. I'm sure you covered this. I've done like 1,700 videos. So I think I might have covered everything, but let's see. My wife is losing her Medicaid savings plan now that I got approved for SSDI. Now she will need to get prescription and specialist coverage. How much can she make part-time? Okay, so she's losing her Medicare savings plan. So that's the one that has been paying her $185. So yeah, how much can she make? It really depends on her particular situation because is she losing her MSP, that $185 because they downgraded her from the QMB or the SlimB or the QI, the higher levels of Medicaid, they downgraded her to a lower level of Medicaid because of your work. If that's the case, she still has Medicaid, and because she has Medicaid, she's still limited to how much she can work. So based on you receiving benefits, money coming in, that kicked her out of the higher levels. But if your household has more money coming in because she starts working, then it might kick her out of even Medicaid completely. So you need to check with, your state Medicaid office because they're all a little bit different. Every state is a little bit different, and find out about that. But one of the things she definitely needs to do, if she lost her Medicare savings, that means she lost her Medicare Advantage dual eligible plan as well. So she needs to find a regular Medicare Advantage plan. There's going to be millions of people that are going to lose that Medicare savings plan, and they need to find a new Medicare Advantage plan because they're no longer eligible for the dual eligible. So you can reach out to Chapter and they'll check to see whether, she still can get it, whether she needs to get to a regular plan or whatever the case may be. But in terms of work, it really depends on the state. If she wants to keep Medicaid, even at the lower levels, she needs to stay within whatever the parameters are of that state. And then on the Social Security side, is she receiving SSDI as well or SSI? Because there's work limitations for SSI, and there's work limitations for SSDI, and there's work limitations for receiving early retirement benefits. So yeah, there's about 5 different things. Sorry. And I can help you out on the SSDI and the SSI part, but on the other ones. And make sure you do, if she's receiving SSI and you were approved for SSDI, make sure she reaches out to Social Security and tell them that she has a living arrangement change that is, there's more money coming into the household because she doesn't want to, get a nasty overpayment. So sorry, I can't help you out super a lot. I need a lot more information, but at least that'll get you started. So, Bernice, how do you get more? I feel like I'm not getting enough. I've worked most of my life and I'm on disability. Yeah, you have to be aware of all the different programs, like the gentleman I was just talking to. If you're on disability benefits, and remember, if you're on SSDI, you start your Medicare after 24 months. If you're low income, low resource, check out on Medicaid, get Medicaid. Hopefully you can get the higher levels and get that Medicare savings plan, and they can pay for your $185. And then check out my website as well. You click on more and you click on the living on Social Security alone, and it gives you a bunch of different programs that might help you out, make your life a little bit easier. So definitely check those out. And then I also have a video in the description. I have a video of living on Social Security alone, and it gives you about 50 different programs that might make your life a little bit easier. So definitely check out the video, and there's a link to it in the description. So Advantage plans are awesome until you need specialty care. Yeah, zero premium. I mean, if you had a crystal ball, if I had a crystal ball and I know I was going to live, another 60 years and then, die from, fall, cliff diving in Acapulco or something like that, some crazy thing, but between now and then, I never get sick or injured or something like that. And heck yeah, I would get a Medicare Advantage plan all day long, zero premium for the rest of my life, and I don't waste any money. Absolutely, I would get a Medicare Advantage plan. But life is what happens while you're making other plans, right? So you get that zero premium, and then something happens next year, 5 years from now, or 10 years from now, and you've got the prior authorizations and limited networks and all that other kind of stuff. So yeah, but if you know 100% for sure you're not going to be sick or injured, then Medicare Advantage is definitely the way to go, 100%. So, but unfortunately, we don't have that. Okay, I've got some video questions that people sent in, so let's get into them.
Good afternoon, Dr. Ed. My name's Irene. I'm calling from Texas, Hondo, Texas. And my question is, I worked for the Sheriff's Department from 1984 to 1988. I wasn't aware they were paying into Social Security. I knew they were paying into Medicare. My question to you is, do I qualify for that WEP program or not? I started getting Social Security when I was 63. I'm 72 right now. But if I hear it from you that you don't qualify because nobody seems to have any records of me working there, of course I don't have any records. That's been decades ago. But my question to you was that, do I qualify or do I just stop looking? I don't qualify for that WEP program. I did take you up on applying for my husband's. He makes more than double that I do. I qualified for that. And I've been helping my sisters with theirs also. So I want to thank you for everything you do for us. And please let me know if I do qualify or not. I really do appreciate it. Thank you. Bye.
All right. Another great ambassador going out there and taking the information and helping those around him. Awesome. So in terms of WEP, yeah, it doesn't look like you qualify because number one, you only worked for the place for about 4 years and doesn't look like they have any records or anything like that. So the WEP is the windfall elimination provision. So that means you worked in non-covered employment, which the Sheriff's Department sounds like in Texas, there it is. So that means during the time you worked for the Texas Sheriff there, you did not pay into the Social Security part of FICA. So what happens is when you received that pension from the Texas Sheriff, then you told Social Security that you receive a pension from a non-covered entity, and then they would have recalculated your benefits and you would have gotten less. Doesn't sound like any of that has happened. Your benefits were not wept. They were not recalculated down. And so, yeah, it sounds like it doesn't apply to you at all because you never notified Social Security that you were receiving a pension. It doesn't sound like you're receiving a pension, so WEP doesn't apply. If you're still kind of worried about, well, maybe I did tell them, if you're not receiving a pension, then no, 100%. But if you are receiving a pension from them and you're not sure whether you told Social Security, just call Social Security and say, hey, is my PIA wept? And they'll tell you yes or no. So it's super, super, super easy. So, but it sounds like it's a definitive no. All right, let's see what else we have here.
Dr. Weir, my name's David. I'm reaching out to you from South Carolina. First, I just want to thank you for the support you offer to the community and for your service to our country. Really appreciate both. I've got a two-part question. First, my full retirement age is in April 2026. I'm planning to file in October with an effective date of January 1st. I'll still be working during those first few months So I want to confirm that from January through March, will the earnings limit be based on the annual threshold, or will those months fall under the monthly earnings limit? And second, I'm a retired U.S. Air Force veteran.
Okay, let me answer the first one. So since it's your first year receiving benefits, you're going to file in October, but you're not going to start your benefits till January. So January is what we're talking about, January of 2026. So if you go over the annual earnings limit, which next year be what, 24, 25,000, we won't know for a while. If you go over that for the year, then they can switch to the monthly. But if you're not going to go over the 24, 25,000, then you're good. So whether you make $25,000 in January or 25,000 the entire year, you're good. As long as, you know, if that's the annual earnings limit for next year. So as long as you stay under that, you're good. Doesn't matter. If you do go over that for the year, then they can switch to the monthly. But since you're beginning your benefits in January, they can't really do this monthly because you're going to have to stay under $1,950, you know, for every month going forward. So, yeah, since you're starting in January, the monthly and annual is kind of, for all intents and purposes, the same. So, and then thank you for your Air Force service. I appreciate it.
And my service period qualifies me for the special extra $100 monthly credit toward my Social Security retirement. When I apply, is that something I need to enter myself on the application, or does the Social Security Administration already have that on record? Thanks again for your time and all the valuable information you share.
Thank you very much. I
My name's
appreciate
David.
it.
I'm reaching.
So the military service, yeah, that's automatic, pretty much. When if you file online or file at an office or over the phone or something like that, they ask you if you ever served in the military, and then they ask you your dates from active duty for a year or longer, and they ask you when you started, when you got out, and then yeah, Congress gives you a little bit extra benefit there. It's not a whole heck of a lot. But hey, every buck's a buck, and it's yours. And at that time, if you have your DD 214, every good veteran always has his DD 214, his or hers. So if you have that, that's great. But usually the Social Security system interacts with the VA, and usually it's not an issue. They have it. If you don't have your DD 214, then you go on to NARA.gov, NARA.gov, the National Archives, and you can get your DD 214. Super, super, super easy. So, all right, let's see what other questions we got here.
My wife is 56 and on SSDI. I'm about to be 62. We are getting divorced. Can I claim spousal benefits and delay my Social Security? And would it benefit me to claim later and get a larger payment?
Okay, so you have to file for benefits on your own record first. So if you're looking for spouse benefits or divorce spouse benefits or independently entitled divorce spouse benefits, if your spouse, ex-spouse is still out there alive and kicking, then you have to file for benefits on your own record first. So you file for benefits on your own record, and if your benefit amount is less than half of that person's benefit amount, the full benefit amount, then you can collect that difference between yours and their benefit amount. But your benefit amount has to be less than half of that benefit amount. So yeah, you have to file for benefits on your own record. You cannot delay like that. There was an option there. You could play around with those numbers, but that ended in 2016.
Hi, I just turned 65 this month. I have not signed up for Medicare yet. I'm an Army veteran, and the VA has been taking good care of me for the last 40-something years. So do I need to sign up for Medicare even though I have the VA? Thanks.
Okay, so for veterans, so if you retired and you have TRICARE for life, then yeah, they mandate you to sign up for Medicare Part A and Part B. If you're not TRICARE, if you're not, if you're not retired, like, I just served 8 years in the Marine Corps, which is like 20 years in all the other services, but I won't go there. But if you're not fully retired, then you're using the VA, the Veterans Administration. a lot of people, you know, they say, hey, I use the VA, I'm happy with it, it's close by, they got customer service and everything like that. So why should I pay for Medicare Part B when I don't use it? I use the VA. Okay, I can see that argument. But what happens when, you know, they're talking about, you know, cutting 86,000 jobs from the VA? And what happens if you move and you're no longer near a clinic? What happens if you need a second opinion outside the VA? Well, you know, all these different situations. So it's good to have a fallback, but you don't want to pay the $185. I understand that's usually what people, they don't want to pay that $185 if they don't need it. There's a couple of ways to do it. One of them is file for Medicaid through your state, but you have to be low income, low resource. So you can sign up for Medicaid, and if they approve you at the higher levels, they'll pay for your $185. If you can't go that route, then there's a Medicare Advantage Part B give back, where you can kind of have your cake and eat it too. So if it depends if there's one available in your area, you can reach out to Chapter and they can check for you. And a Medicare Advantage Part B give back is just as the name applies. It gives back part of your Part B, maybe $50, $100, $185. And they're specifically, a lot of them are specifically tailored to veterans like you. They're named honored plans or patriot plans and stuff like that, because that's, you know, mostly who uses them. And they pay for part of your Part B. So you can have both. And that way you've got massive coverage, all the coverage you need just in case, and you're not having to dole out money. But if you decide not to go neither of those routes and you just refuse Part B completely, that's fine. You're not mandated. You don't have to sign up for Part B. You know, you're ex-military. Nothing in life is mandatory, but the repercussions are, if you sign up for Part B later, you change your mind, something happens a year, 2 years, 3 years, 5 years later, you're going to be penalized for the rest of your life. 10% for every 12 months you did not have Part B. So, and then you can only sign up in January, February, and March during the general enrollment period. So, and this is the same thing for, you know, people that go overseas and stuff. So, and that's it for my my recorded videos. If you want to record a video and ask me anything or make any comments or anything, dispute something with what I said, I love those. Give another interpretation of a law or what some politician said, please, please, please go onto my website, mygovexpert.com, and on the bottom left it has a little camera icon. Press it and you can record a 2-minute video. What happened when husband and wife on disability and husband passed away? Then you're eligible. This is a good question that a lot of people, there's so many people out there that are eligible for benefits, and it like Althea, in your case, you're probably saying, well, hopefully you're not, but you're probably saying, well, I'm receiving Social Security disability insurance, and sure, I'm eligible for more money as a surviving spouse, but if I get that surviving spouse benefits, I'm not 65 yet, and I'll lose my disability. And I have Medicare because of my disability. So if I get off my disability and go to survivor benefits, I'll lose my Medicare. 100% incorrect. You will continue to have disability and you'll get that extra money from survivor benefits. One offsets the other. You don't get 2 full checks, but one offsets the other. But you'll get disability, you get survivor benefits, you get disability spouse benefits, disability divorce spouse benefits, disability independently entitled divorce spouse benefits, but you'll still have disability underneath there. And because you still have disability, your Medicare will continue. So sorry for your loss there, but number one, definitely reach out to Social Security and get that lump sum death payment, $255. I know it's embarrassing, but anyway, yeah. But at least get that and then check out survivor benefits. And again, it won't affect your disability. It won't affect your Medicare. How much are they going to deduct from our Social Security in 3032? I don't know, $1 billion? 2032, 2030, yeah. Deduct from Medicare maybe? Yeah, that's, oh, you were talking about, okay, so if you're talking about Medicare, then the $185 this year, maybe $195, $200 next year. If you're talking about the cuts that are coming in the future, then in 2033, we're looking at 23% cuts. And because these guys and we're the guys who sent these guys to that building. They have failed us for 40 years and not solved the problem. So, could you tell me what is going to happen to the ACA? Wow, there's so many companies that are bailing out of the Affordable Care Act. And prices are going to be going up substantially, anywhere up to 75% I've seen for next year. Yeah, so it's crazy. So, Fast Eddie, what's your PhD in? Intellectual history, American intellectual history. So, not a medical doctor. Anyway. Okay. Let me get some new people that I don't recognize. Did Trump ever get the awesome Medicare plan done he was working on? No, but I heard that for what 8 years now, he's got it. It's all written out and it's on his desk, and he is going to release it next week or two. No, it's always 2 weeks from now. Yes, 2 weeks from now. So, it's the longest 2 weeks in human history. Did I understand you right that when Cricket Oz does this thing that all my medications have to be approved by a bot? Is this to deny us med? Okay, so this is, there are like 17 different procedures, some different injections and skin grafts and stuff like that they say are high fraud. There's a lot of fraud in those. So they're doing 6 states. And in those 6 states, they're picking these 17 different, suspicious, not suspicious, I guess. They're correct procedures, but they're being used, a little bit too much or something. So they picked those 17, and so that is supposedly a test case. So if you are hesitant about introducing prior authorizations to original Medicare, which I am hesitant about, then you need to reach out to your politicians and say, yeah, no, don't even try it. So, any thoughts how the diminishing jobs due to AI will impact Social Security solvency? Yeah, big time. It's going to hurt it a lot. Because if you don't have people working, I mean, right now, about 90% of your check, if you're receiving Social Security benefits, 90% of your check comes from people currently working. It's a pay-as-you-go type system. The other 10% comes from the trust fund, the savings. So people all, always say, hey, the trust fund is stolen. It's not really there. It's all fake IOUs. I tell those people, all right, then, if you think that 10% of your paycheck is fake, then please give it to your local shelter, homeless shelter, animal shelter, charity. Give it to charity because they think it's real money. If you don't think it's real money, I'm sure they'll think it's real money. So please give 10% of your Social Security check to them. But 90% of the money coming in goes to checks immediately. And if less money comes in, that means we're going to have to pull more out of the Social Security Trust Fund. And then we're not going to have 90 checks left. We're going to have 80 checks left or 70 checks left. Yeah, it's not good. It's not good. So hopefully, hopefully something happens there. But so if you go in the hospital with I was going to get into the Industrial Revolution and labor and all that kind of stuff, but I won't go there. So I won't bore you. So if you go into the hospital with a supplement, you still have a hospital deductible for Part A. Yes. It depends what particular plan you have. If you have like a plan G or an N or F, then yeah, it covers all of that. Plan G covers all the gaps of original Medicare, except for that Part B deductible. It's a one-time deductible of $257. So yeah, if you have a supplement, it covers the hospital deductible. So most supplements. Let's see. Can I take my ex-husband's Social Security? If we are married more than 10 years, then take mine at 7. So 70. Okay. So if your ex-husband is deceased, then yes, you can take surviving spouse benefits and not touch yours, and then wait till 70 on your own. If your ex-spouse is not deceased, then you have to take benefits on your own record and then take benefits again if there's benefits available from your ex-spouse. And it sounds like you met the requirement for the years, 10 years. You had to be married at least 10 years. Traditional Medicare plus a supplement plan is absolutely the best health insurance available for seniors who cannot afford private insurance. Medicare Advantage is a huge, huge boondoggle. Yeah. Yeah, I agree. Always get a Medicare supplement plan if you can afford it. If you can't, then you can't. Then it just takes a lot more work with Medicare Advantage plans, because Medicare Advantage plans are only good for 1 year. People say, I've had the same plan for 3 years and I'm happy with it. I'm like, well, that's great. So you're happy, but it's not the same plan. The plan you enrolled in 3 years ago is gone. 2 years ago, it got changed to a new plan. And then last year it got changed to a new plan. And this year, December 31st at midnight, it's going to be changed to a new plan. You'll have the same card, the same doctor, the same company, and all that kind of stuff. But all of the stuff under the hood could very well change. And next year, I think we're going to see a lot of big changes with all the craziness out there. People that say, Ed, you said that in October last year. I did. Because Part D, there were a bunch of changes to Part D. They switched the max from $8,000 to $2,000, and the health insurance companies had to rush around and try to cut back a lot of Medicare Advantage plans to compensate for what they were losing, and a lot of things changed. This year it's going to be, what do they say, hold my beer. This year is going to be crazy. So you can reach out to Chapter and say, hey, heard it's going to be crazy next year. Put me on the list for, starting October 15th. You have between October 15th and December 7th to switch, to see. You might not even switch, just to see if your plan is still the best plan for you. And if it's not, you switch it, you find a new plan, you go through your doctors you want to see, you check out your prescriptions, networks and everything, you check out all the other bells and whistles and see if there's a better plan for you. And that new plan begins January 1st. So you have until December 17th, or excuse me, December 7th. So from October 15th to December 7th. So, how do I get Medicare on disability and I'm 56? If you're on Social Security Disability Insurance, SSDI, your Medicare starts automatically after being on disability for 2 years. So a lot of people mess that up. A lot of people don't mess it up. They don't realize that. They've been on SSDI for, 3 or 4 years, and they're saying, I really need to go see a doctor, but I don't have health insurance. Like, no, you do. You have Medicare. No, I don't. I don't have a card. They just didn't receive the card. They, moved and Medicare sent it to someplace else, but they have Medicare. So that's sad. So reach out to people that have disability and say, hey, after 24 months, you get Medicare, right? If you're receiving SSI, Supplemental Security Income, then unfortunately, no, because you didn't pay into Medicare probably that much, enough. But if you're receiving SSI, the welfare-based program, then you should definitely apply for Medicaid, because in most states, I think in all states, you're categorically eligible for Medicaid being on SSI. So, and if you want to find out, you call Medicare, go on to the website, or call Chapter, and they can see if you're on Medicare, and get your Medicare number and all that kind of stuff. What did you mean earlier when you said that after having a Medicare Advantage plan, you may not be able to have a Medicare supplement plan? Anybody can get a Medicare supplement plan anytime if they can pass health underwriting, and that's the issue. When you're 65 or when you're newly eligible for Medicare, you have a certain amount of time, 6 months, to sign up for a Medicare supplement plan. With no health underwriting, no extra costs, they can't deny you, you're done. Easy, easy, easy. After that time, there's also kind of a trial right for the first year. So if you have a Medicare Advantage, sometimes there's these trial rights, and it really depends on what your states. It's all crazy complicated. I think they make it complicated for a reason, but that's why I recruited Chapter there to help y'all out. But after that, let's say a year, 2 years, 3 years, 4 years later, you can still get a Medicare supplement plan, but you have to go through the health underwriting. So they can deny you, or they can charge you a lot more money because maybe of your medical condition or your age or whatever the case may be. So, well, I guess I'll the video I'm going to do maybe tomorrow or the next day is there are health insurance companies that just notified people, or just in their board of directors meeting, their shareholder meeting, that they're going to be kicking about 600,000 people off of PPO plans. So they're going to be terminating these, I think other ones are going to follow suit. So probably about 1 million people are going to lose their Medicare Advantage plans. They can go for another Medicare Advantage plan in the same company or a different company or whatever the case may be. But when you're terminated, when they terminate your Medicare Advantage plan, they send you a letter. And then that letter, that's the Willy Wonka golden ticket. If you're 85 years old and in terrible health condition and you get this golden ticket, you can now sign up for a Medicare supplement plan. They can't deny you because you've been terminated. So that's the kind of the silver lining there. So there's different exceptions to signing up for a Medicare supplement plan. So I'll talk more about that tomorrow. So all right, let's get one more question here. She is SSDI 2. She has A and B, and they told her we income disqualify her for Medicare savings. Yeah, okay. So you're the one that she lost the Medicare, the $185 because you started your SSDI. So she still has Part A, Part B. So now they're going to start charging her her $185. And it's even worse. This is going to happen 10 million times, unfortunately, because all these people are going to be losing Medicaid. Here's what's going to happen. So she lost $185. She has to pay $185 now. She lost her Medicare Advantage dual eligible plan. And maybe she was receiving some type of grocery card or over-the-counter card for $100, $200. She's going to lose that because she's not in the higher levels. So she'll have to downgrade to a regular Medicare Advantage plan, and she'll have more health care costs as well. So yeah, that's unfortunate, but she has to find another regular Medicare Advantage plan. So whoever helped you sign up, if you know anybody, or you can reach out to Chapter and they can help her find a regular plan. And for you, if you're just started your SSDI, remember, you're going to get Medicare after 24 months. And here's another thing that people mess up. Say, for instance, you filed an appeal and you've been waiting 2 years and they finally approved you for Social Security disability. So they retroactively back paid you for 2 years. You're like, oh, okay, then my Social Security disability benefits are going to start today, so I have to wait 2 years from now. No. Your Social Security disability, they back paid you retroactively for 2 years ago. So actually your Medicare starts today. So a lot of people miss that. They go out there and buy other plans and spend money and stuff. And all of a sudden they get a card in the mail and say, oh yeah, Medicare, wait, I haven't been on for 2 years. Yeah, you have, it just took 2 years to get you approved. So make sure, if you're not exactly sure when that 24-month is, call Social Security and say, hey, just for planning purposes, when is my Medicare going to start? So that's always a good idea to save you some money. All right, we are over an hour and I went over a little bit. So I will be back again tomorrow and do another topic of the day and answer a whole bunch of other questions. In the meantime, y'all have an awesome, awesome night. And please, please, please,